So, I just want to give you guys a brief overview of what is happening when we are doing screening assessments. Why are we gathering this information? What leads to the information that we are gathering? And then ultimately, what will we do with this information, which is to create some corrective exercise continuums for our clients. So, when you look at just what we're trying to go for is our optimum neuromuscular efficiency. So, what that means is all of the muscles that are either agonists or antagonists that either help or hinder different movements, that are synergistic, that all of the muscle skeletal system and the nervous system is working in the most efficient way that we possibly can. And how that is comprised is of these three different things. One is the length tension relationship, which has to do with our muscular system. So it's looking at the very inside of the muscle where all this action is happening with our actin and myosin. Is that working effectively? Are we optimizing this relationship between the length and the tension of the muscle? We also have the nervous system, and that we have to remember that with the nervous system, we don't just activate one particular muscle, we actually activate muscle groups. So, are we getting this coupling of our force that actually allows us to be able to contract our synergistic muscles to aid with us, to aid in the motion that we are doing? And then we literally just have the joints coming together in the skeletal system, and are they contiguous with each other? Are they stable? Are they strong? Are they in right alignment? And when you have if we have good efficiency in each one of these things, we will also have good optimal neuromuscular efficiency. So, what happens when we start to have impairment? Well, there's some kind of a dysfunction that tends to happen, and it can either come because of a deficiency in the length tension relationship, of the force coupling relationships, the altered arthrokinematics, which we just talked about, all three of those things. And what ends up happening is it ends up giving feedback information to let us know that things aren't appropriate in the system, right? So we get an altered sensory motor integration. We also get altered neuromuscular efficiency. So when one of these things, one of those three things, the length tension relationship, the force coupling relationship, or the arthrokinematics is off kilter, we're also going to have an altered neuromuscular efficiency. And what ultimately ends up happening is tissue fatigue starts to occur, and it actually starts to break down some of the tissues, right? That's going to create an inflammation process as we do this. So, what is this cycle that we're looking at, right? So, we start with having a cumulative injury. We get an injury of some sort, we get tissue trauma to that place wherever that injury occurred. We have inflammation starting to build up, and we'll talk about inflammation a lot. We have muscle spasms that will start to occur because of that. Those muscle spasms will actually lead to adhesions on the sheaths that cover our muscles. When that happens, we actually will alter our neuromuscular control. So we'll end up having a dysfunction in how our nervous system is communicating with our muscular system to actually create those contractions. And ultimately, when we have that altered, we end up having a muscle imbalance that starts to occur. Now, it just is small in the beginning, but then that muscle imbalance is going to feed back into this exact cycle, right? So then the injury becomes worse, or at least the ramifications of it become worse. We get more tissue trauma, we get more inflammation, more muscle spasms, we get more adhesions, which impairs that neuromuscular control even more, which creates more imbalance. And this will continue to cycle and cycle until we can actually break it. And we're going to talk about how do we break it. So when we have our joint dysfunction, right? And we have these different altered things, the length tension relationship, the force coupling relationship. We get altered movement because of that, because we have those muscle imbalances. And essentially, it ends up just causing structural and functional inefficiency. So the system is no longer working at optimum neuromuscular um, efficiency, and instead we are impaired, right? So when the joint is dysfunctioning, it changes how that joint is coming together, the actual surfaces of the joints coming together and the muscles that are around it. It tightens and spasms, it spasms and then tightens in order to protect that joint. And that's when it is initiating that cumulative injury cycle, and we have to break it. So we do that with a corrective exercise continuum, right? It's a systematic programming process used to address all of these dysfunctions. And the way that it does it is through 4 different steps. We have inhibition, lengthening, activation, and integration. And we are going to talk a lot about this. So when we are inhibiting, there's different inhibitory techniques that we can use. A lot of it comes down to self-myofascial release. So what we're trying to do is disrupt what is happening in that local area where the nervous system is coming in and integrating and innervating where the muscle is. And so we're going to break up those adhesions that are starting to form on those sheaths. And we're going to, on that fascia, in order to stop and inhibit what's happening in that area. The next thing we do after that then is to begin to lengthen these muscles that are being impacted by the spasms and the muscle tightening, right? So after we inhibit those messages through that myofascial release, then, and we'll talk about how that works, that process works as well in later. Then we have the lengthening techniques in which we're doing things like static stretching, neuromuscular stretching. We're going to talk at length about the different types of stretching that we can do and what the benefits and pros and cons are. After that, we're going to take these muscles and we want to activate them, right? We need to activate some of our weaker muscles. So the inhibiting and the lengthening often happens when we've got overuse of the muscles. Then the activation and integration is when we are trying to build up muscular strength in the muscles that are not currently activated because we have the strong muscles taking over for the weak muscles. So activation techniques, we're going to isolate to strengthen specific muscles in order to build overall strength together. And we're going to do that in a couple of different positions to be able to build that. Then we start working on trying to integrate all this information together. So we'll take just activation exercises and start building up until integration exercises in which they're more dynamic movements that maybe cross multiple joints. So this is kind of our basis that we're going to be working towards. So when we're talking about inhibition, essentially what we're doing is we're releasing the tension and turning off the overactivity that is occurring in the myofascial tissues, right? Because of this injury cycle that's happening, we get this overactivity, we get these spasmings occurring, and we're going to release that tension in order to turn that off. This tends to be in our prime movers or our agonist muscles. So these are the ones that we will see it in. Typically it's like hip flexors and quadriceps and hamstrings and the pecs and in the trapezius. These are the ones that often cause people issues because they are taking over a huge portion of exercises and movements instead of having the body more balanced. And the reason or the way that we can do this, self-myofascial release, in which really we're looking at like foam rolling techniques. So we'll be spending some time talking about foam rolling as well. Then we're going to go into those muscle groups that were overactive and we're going to start lengthening them, right? So we are increasing the extensibility, the length, the range of motion of all of these tissues that are being impacted. So we're going to, because they have been tight, they start to shorten and the connective tissues are tight and are shortening as well. And so we're going to work on elongating and all those shortened muscles and the connective tissues that are shortened. We can do this through static stretching and neuromuscular stretching, and we'll talk about each one of those. Next, we're going to move from those overactive muscles into our weaker muscles that we have and start with activation. So we're going to re-educate our muscles on how to function and when they should be firing, right? So we're going to stimulate them to fire and increase the activity to these underactive muscles. The imbalances and pains will never be eliminated unless we can actually strengthen these weaker muscles. It's great for us to foam roll and to stretch our overactive muscles, but if we just then go back and start working, all those muscles that are overactive are still going to be the ones firing. Instead, what we want to do is we want to deactivate those, lengthen and stretch those overworked muscles, and now start building up strengths in the ones that are weaker muscles so that we can have more balanced movement. So mostly what we're doing during this time period is it's not building actual strength. We're not trying to buff up these muscles. First, we just need to activate them. So we're going to work on motor unit activation and firing of those muscles, having the nervous system be able to synchronize so that now it's working as a coordinated movement in order to get all the muscle fibers to be firing at once and increase the firing rate. And so we're going to do that through pinpointing certain examples of exercises. So these are activation exercises and positional isometric exercises. Remember, isometric is when we are not currently moving, we are just holding contraction. So we can do it through activation exercises as well as isometric exercises. Some examples that we might be seeing as far as what are these activations exercises that we could be doing. These would be things like clamshells and fire hydrants in order to activate our glutes and our external rotators. It could be that we want to activate things like our rhomboids and our lats by doing scapular punches. We could also do isolated exercises on any part of the body, as well as our isometric exercises that aren't doing any movement, where we're just holding contraction. After we have activated the muscles, kind of woke them back up and said, hey, we need you to be functioning as well, not just the overactive muscles, we're going to start incorporating larger movements into the exercise program. So these are using things that are dynamic exercises that cross joints, that use multiple muscles to do that and require a lot of coordination. They're not just isolated. And this will include our progressions and working from wherever our client is at to be able to get them back up to full functional movements. And we'll go through progressions to be able to do that. And our method for doing this is actually our dynamic movement exercises. Some examples of this would be things like having a resistance band around our thighs and doing some lateral walking, or using a tube or a resistance loop to be able to do that. Things like squat to overhead press. We're doing multiple joints, multiple muscles involved. A step up to overhead press, a single leg squat. Those are all examples of what we could be using. So this is kind of what it would look like if you were doing an exercise prescription that was dealing with a corrective exercise continuum, right? So you have the inhibition, lengthening, activation, and integration. How are you going to be doing that? This will be through like our self-myofascial release. Here's going to be our stretching. Here's going to be our isolated activation exercises and isometric exercises. And here's more of our dynamic movements. Here would be listing down like what are the muscles we need to be focusing on for this? What are the muscles we're focusing on for this? What kind of muscles are we trying to activate? And what are we trying to work with our integration? And then giving instructions on how to do all of those movements. So something that you guys could look at is that when you're conducting some kind of an assessment, you're going to start to notice that things are happening. So for instance, in a postural assessment, you might notice that your client is starting to flatten their feet, or you can notice that there is extreme feet flattening and knee flexion that's happening, internal rotation and adduction, right? So when you're seeing these, and you're looking at your postural assessments, which muscles are the ones that are tight and overworked? These are the ones that need to be inhibited and lengthened. right? And then which ones are weak and undertrained? Which ones are, and these are the ones that need to be activated and strengthened. So we can use our information from our book to be able to find out, okay, so when I'm seeing these things in my assessments, this is what this means. These are the muscles that are tight and overworked, and these are the ones that are weak and undertrained. And then we can start building an exercise continuum for that. As we move into our movement assessments, we can do it with those as well. So for example, with a push-up assessment, you might notice that the lower back is sagging whenever they're performing the push-ups. So we can look that information up and discover which muscles are tight and overworked, and these are the ones that are needing to be inhibited and lengthened, and then which ones are weak and undertrained and need to be activated and strengthened. So right now, we are just starting at this basis of doing these assessments and then looking up with the information that we have, what muscles are the ones that are being affected, either because they're tight and overworked or because they're weak and undertrained. Then towards the end of the term, we're going to start looking at what kind of exercises do we need to do to be able to deal with these issues. So that's kind of the route that we're going, the direction that we're going with this class. And I just wanted to give you a brief overview for that as we start to dive into these assessments and figuring out which muscles we do need to pay attention to.